Good morning, students. Today we are here to discuss the same topic which we have already started from last two lectures. In that, we are discussing education and training of medical staff, for which we are planning various programs. Out of them, we have discussed three programs in last two lectures. Today, we will discuss remaining two types of programs which need to be discussed in this lecture. In that, third program is in-service education. What is in-service education? In-service education is a planning learning experience provided by the employing agency or employees. Is a typical type of short sort of education which has been planned during your job. On job planning has been done for your any small sort of education, any course, any small sort of training which need to be given during your job schedule. It can be planned in 5 days schedule. At the weekend you can plan, or any typical week which we can give for the typical programs. In service education is a planned educational experience provided in the job setting and closely identified with services in order to help person perform more effectively as a person and as a worker. Concepts in service education: closely identified with services. During services, if anything which you can identify that I must learn this thing, I must learn this skill, this technique to improve my work, so you can identify that typical technique, help a persons to improve performance effectively. If you are lacking that techniques, if you are lacking that typical function, typical skill which we need in that work during their functioning, if you have, it will definitely improve your work. Planned education activities: these activities you can plan at typical period of your job. As I told earlier, at weekend, at each weekend for 6 months or for a few months, you can plan, or in a week for 2 days, or on the last day of your week for few hours. In that fashion, you can plan for several hours or for several days, provided in a job setting. Your job setting, your job profile is there. During your job profile you can plan that program, that typical course, small sort of course. It may be regarding computer awareness, it may be regarding learning any typical language, it may be regarding learning or understanding any software, or to develop a knowledge of any instrument, any new thing, any new skill, or handling to the customers or handling to the patients, or any medical sort of devices which you learn how to handle that, or any you can plan that. Changes and scientific advancements. Changes and advancements in the field of service. There are lots of changes occurs in our medical field, and according to the need of medical field, according to the new development which is going on into our medical field, you have to change ourselves, and for that we need these programs. Increase the demand of nursing services all over the world. The nursing demand is has been increased. India is the largest exporters of nursing service. From Kerala and from South Indian states, lots of nursing staff is doing their job across the world, mostly in the Caribbean countries, or in the Saudi Arabia or Oman, or in UK, US, all over the world they are working, and there is high demand of nursing staff all over the world. Consumer demand quality care. Consumers also demanding for developed staff need to be required for their quality care. If well trained nursing staff or medical staff is there, it will give the good quality of service to our patients. Rapid changes in the medical and nursing practice create a need for the service education. Always there is some things need to be increased or added into your syllabus, in your books, so that update knowledge we must have. Increased number of people seeking healthcare as a population enlarges make it necessary for the hospital staff to function at his highest potential as quickly as possible. As healthcare delivery system become more complex, the need for continuous skill training also increase. We need to continuously we must learn the new things from our scientific field or our medical field, and we should implement that knowledge into our work. By that way, we will improve our work. What are the aims of this in-job training? Improvement of client through upgrading the services rendering with scientific principles to keep in phase in changing society to their needs. Acquisition of new knowledge, a bunch of new knowledge which you can implement, you can incorporate, and you can authenticate that new knowledge. You need to be included into your work. Improvement of performance, if you are having that new knowledge, new skill from your new medical field which has been you have incorporated from the various sources, so it will help you to improve your performance. To develop specific skills required for practices, to develop right concept of client care, to maintain high standards of nursing, because we are competing all over the world. So what is the other countries staff, how they are treating patients, how they are caring patients, how they are giving the medical facility, nursing facility. So in that fashion we need to develop ourselves in that way that we should also able to give that type of facility. To observe and bring change in staff members chances for promotion, if you are giving your full efforts into your job, you must get promotion, and by giving promotion you are encouraging those staffs who are doing their work honestly and very effectively. To reduce turnover absenteeism, by this way, we can also decrease the absenteeism among the staff, to discover potentialities, to alert personnel in working environment. Steps in service education. There are two steps. The first is assessment. Pinpoint needs, prioritize needs, set training objectives. We have to set some objective, what things which we can learn, how we can plan that we can discuss. And priorities, which thing we should learn first. What is a priority? Out of all the courses, which course is very important, which training is very important for our staff, that we can identify. And develop criteria, which criteria you need to fulfill after completion of this program, that also we need to be identified. Next, implementation, climate check, actual conduction of training with ongoing monitoring. Climatic change means the day from which we have started the program, the training or the typical course, from day one we should check how much the staff is understanding, whether it is really affecting their morale, really affecting on their skill, really they are getting some knowledge, they are upgrading their skill or not. We should monitor the program during the course, and it will help to increase the effectivity of your implementation. And if any lacuna is there during implementation, we can improve it, we can change it. So in this fashion, the various objectives which we can fulfill. Continuing education, it is another sort of or another type of development programs which we can give to our staff. Continuing education is all the learning activities that occur after the individual has completed his basic education. Whatever degree he got or degree or post graduation he got from the educational departments, after that whatever things he is learning, he's during his job or from his hospitals or nursing home, whatever education or whatever information he's gathering, he's acquiring from his senior staff, or from the conventional way, what are the basic goals or what are the SOPs, what are the SOPs of that hospital or that nursing homes, what standard they have set. And during your entering, when you are enter that typical organization, so during your job, what things you are learning which you has been started to learn, that is nothing but the continuing education, the education which builds on previous educations. Need for continuing education to ensure safe and effective nursing care, as nurses need to keep abreast with interest, knowledge and technical advances to meet the needs of population. Because as population is increasing, accordingly we are not increasing our medical or nursing demand, so we must increase their numbers. Because if nowadays you might be aware of that in this COVID condition, hospitals are not sufficient to take care of all the patients, as the patients are increasing progressively day by day, and we have to keep the patient at their home if they don't have their symptoms. So in that case, there is huge demand of nursing staff to take care of patients. So for that, you must give them proper training, you must give them proper education to develop the doctors, pharmacists, and nurses by updating their knowledge and prepare them for specialization. You should develop the doctors, pharmacists, and you should upgrade their knowledge and prepare them for the specialization. So what knowledge you have gained in your education, so that knowledge you must upgrade and prepare them for specialization. So what knowledge in their field, how can they upgrade their knowledge? You must give them